Well, it's time to talk about your spine. Do you ever talk about your spine? I don't know, but our next guests do. They talk about spines every day. Stay tuned. With us now are Dr. Passias and Alexa. We're going to be talking about scoliosis and spine deformity. Welcome to the show. How are you?
Great. Good.
Good morning. Thank you so much.
Hi. So I'm going to go off the card just so that I get the name correctly. It is the New York Spine Institute Center for Scoliosis and Spinal Deformity, and all the types of surgeries that you perform. So I know that the center has a research team. There's so many things, but let's just start with the basics. Dr. Passias, what is scoliosis?
So scoliosis is a complex term that refers to kind of a three-dimensional problem in the spine. The spine can be rotated in the side plane, it could be rotated in the frontal plane, but oftentimes it occurs in tandem with deformities in both planes.
Now, Alexa, the two of you have been working together for quite a long time,
Yes.
right? How does it feel when you see a patient present with this type of deformity and you're able to actually help them?
It means a lot. Scoliosis is something that's very debilitating for a lot of people, for young people as well as older people, and being able to find a way to correct that with surgery is really amazing. It helps really transform people's lives.
Now, we had met prior, and one of the things that I learned about scoliosis is that I always thought that it only made an S this way. I did not realize how you were talking about how it can torque and how it must be painful. Is scoliosis painful sometimes for people?
Yes, that's a great point. And oftentimes it can result in pain, functional limitations, and in many cases these patients can be disabled to the point of malignant cancer or other very severe medical problems. So it's a very disabling entity.
Is that because the spine and the blood flow sometimes can get restricted, causing other diseases? Like, why is it? I know, like, your teeth are connected to your heart, right? But your spine actually is connected to the entire rest of your body.
Yeah, the spine is literally the backbone of your musculoskeletal system, but more importantly, it houses some of the most critical nerves in your body that control things ranging from your breathing rate, your heart rate, to basic function and movement of your limbs. So it's a critical structure.
And at what age do you feel like people, Alexa, should get, seen? I remember being in school and they would have you bend over and they'd try to see if I don't know if they're even still doing those screenings anymore.
Many times the first person to assess a child for scoliosis is their pediatrician. So a pediatrician at every yearly visit that they have, probably from age 6 the latest on, should be doing exactly what you said, that forward bend test to evaluate you to whether the pediatrician sees a little bit of a curve. And if they do point it out to you, then the next step would be to come see us.
So I'm going to say this one more time. I'm going to say it correctly. At the New York Spine Institute Center, and I know they have a little short acronym, but for scoliosis and spinal deformity. So when you diagnose someone and they need surgery, what is that process like? Can you walk us through?
Yeah, it's something that our team here, you're seeing the two main components of the team, but it's something we take you through from the onset to the recovery period. And sometimes these procedures can have recovery periods ranging from 6 to 8 weeks. Sometimes it could be more prolonged, where the spinal cord has significant dysfunction up to 1 to 2 years. So it starts with obviously an initial consultation where we welcome you to our home, and we kind of explain to you the process that's undergoing and what the options are for treatment. And if it is something that can be benefited from surgical correction, we take you through medical optimization, physical optimization prior to entertaining a surgical procedure, and certainly we take you through the recovery process. And I like to say my surgical patients, especially for scoliosis and spinal deformities, are friends and patients for life. We see them throughout the remainder of their life. Spinal deformity is really a chronic disease, and it requires chronic management.
And I realize too that it is about that, how you said how you're friendly with your patients. You really care about them. You want to make a difference in their lives. You're sometimes often invited to their weddings, or, and sometimes they can actually, if somebody has a prom or something else that they're going to, you'll work within their schedule. You customize. It's not like just, okay, next, this person next, but you're customizing a solution for them for their spine. That must feel so gratifying.
Absolutely. One major thing that you get when you come to see us is a small group. You're going to see myself, you're going to see Dr. Passias, and we're going to carry you the whole way through. We know when you come in and tell us, like you were saying about a prom, we know this is an issue, we know it needs to be dealt with, but we have to get to that date. This is what we do. We understand what the recovery is and how long it is, and we'll remember that. And Dr. Passias is amazing at remembering that. You tell him one thing about yourself one time, and he's going to ask you about that for the rest of your life. So if you want to get to prom, we'll get you there.
I love that. Is there anything that I didn't ask you that you would like to share? I know what makes you different. It is your kindness, your humbleness. You guys are both so well educated, and you are constantly researching all of the latest. You have beautiful equipment at your facility. Is there anything that I hadn't touched upon that you would like to speak about from your heart?
Alexa?
I really just think the biggest thing for us is, when you come to see us, you're going to be a person. It's part of our family. You're not a number. At a lot of big institutions, you're one of a number. And when you come to see us, we really have a vested interest in getting you back to playing the sports that you like, or even as simple as letting you be able to walk around the block when you weren't able to do that before.
As always, I think Alexa said it very eloquently. These are customized treatments for individual patients. There's no cookie cutter approach. There's a warm team collaborative effort, and we'd like to invite you into our family and really help you with your spine care.
And if someone doesn't know they have a problem, but sometimes they're like maybe walking with a little bit of limp, it could come from the spine. Absolutely. So somebody that might just have some sort of a problem could come in and get a diagnosis from you, right, and an evaluation, and be like, you think it's your hip, but it's actually your spine. Absolutely. Or you think it's your ankle, but it's actually your spine, correct?
Oh, it's a very common issue, and I've had patients who've had limb lengthenings, hip replacement procedures, extensive reconstructive procedures of the limbs before the medical community really acknowledged that it was a spinal-related problem. So the spine is the backbone of the body. It houses important neurologic structures. Always look at the spine first before making other musculoskeletal diagnoses.
I appreciate that. Yeah. Thank you very much. You. I know you took time out of your busy day to come here to our home, and I truly do appreciate it. And we were talking about before, like each of these things have a name, right? And I had them all kind of completely confused, but. Of the vertebrae, how many are in your spine? Is it like a piano key? Is it 88? Some people have more, some people have less?
That's a great question. So there's fixed or immobile parts of the spine, like our pelvis, which in development undergo a fusion process, the sacrum and the coccyx. And then there's the mobile spine, which is the lumbar. About 95% of the population have 5 lumbar vertebrae. There is some variation. And then most of the population is about 12 thoracic. And then moving to the top, the most functional component of our spine is the cervical spine, which has about 7 vertebrae. Yeah.
Excellent. So there you go. So it's like playing a piano. You just got to make sure that they all play beautifully well together.
Exactly.
Thank you so much.
So much.
Stay tuned for more. We've been living it up right here. We hope you in your community have an opportunity to go see someone. And if you want more information, just go to their website.